All right, that'll take us to our superintendent report. So I'll turn it over to Dr. Roy and our public health experts who are here tonight to give their input on the current situation. Dr. Roy?
Oh, thank you very much. So we wanted to provide an update to the board and the community in advance of the Thanksgiving holiday. So we have with us, I'll just introduce one by one. First, Dr. Rajika Reed, who's a Senior Director of Epidemiology and Strategy at St. Luke's University Health Network. And so I'm asking Dr. Reed to kind of give us the big picture of what the hospital network's seeing, what they're seeing in the larger community. Dr. Reed?
Yes, hello. Good evening, everybody. So as you all know, we are seeing increasing incidence rates across Pennsylvania, as well as positivity rates increasing. We're seeing very similar trends in the Lehigh Valley and our surrounding area, the area that St. Luke's serves. We're seeing increasing number of admissions at the hospital that are COVID related. We have close to 100, we have over 100, close to 150 actually. And ICU beds are starting to get filled with COVID, but also with other emergent conditions. We're finding that folks are still waiting to come in for care, and that's putting them at risk. Approximately 16% of our COVID admissions are in the ICU currently. And additionally, we are seeing COVID fatigue and burnout among all levels of our staff. I think we've all been fighting this pandemic for a while now, and we're definitely seeing the effects of some of that. And this is concerning because it doesn't really give us an excess of employees as, you know, to rotate out and tap in, so to speak. But given these conditions, we urge you to continue the social distancing, masking, and hand hygiene guidelines we've been following. Some of the modeling out of Washington State suggests that in this area, we might peak only around mid-January, end of December and mid-January timeframe. So as far as you know, what we need to do to stay safe and keep kids in school is really a lot of maintaining what we've been doing.
Any questions for Dr. Reed? All right, I want to thank you also. Dr. Reed is part of our Thursday afternoon team. We meet every Thursday afternoon to compare notes and get updates, and also for to make sure that as our representative from the St. Luke's that Dr. Reed's in the loop on everything we're doing and advising us on what we're doing. So thank you. I'll move now to Kristen Wenrick, the director of the City of Bethlehem Health Bureau, who will kind of take us down another level to the kind of the district level and talk about some of the news that came out of Harrisburg today and her take on that.
Good evening. First, I'll start just by talking a little bit about the data and what we've been doing at this point in time regarding metrics that we've been monitoring, and then I'll move into the newly released mitigation orders today. So as Dr. Reed had explained, we're certainly seeing an increase in the number of cases. So this isn't any different than what's occurring across the country and across the Commonwealth. A few weeks ago, I think it's about 3 weeks now at this point, that we entered into substantial spread in Northampton County, and that's defined as 100 cases per 100,000 over a 7-day period. So really over the last few weeks is when we start to see the uptick in the number of cases. Currently in Northampton County, we're at 276.9 cases per 100,000. And that, again, that's over a 7-day period. And in Lehigh County, we're at 294.5 cases per 100,000 over a 7-day period. In the city of Bethlehem, we're slightly lower, but nonetheless, certainly high enough. And we're currently at 248 cases per 100,000. In addition to the cases that have been increasing, we're also seeing our positivity rates increase. About a month and a half to 2 months ago, locally, we were down in the single digits, around 1–2%. Right now in Northampton County, we're hovering around 10%, and in Lehigh County, we're slightly over 11%. We had our highest case count 2 weeks ago, and we topped that last week. So we're in a position now that we have more cases than we did in the beginning of the pandemic. So that's something that's definitely taxing, as Dr. Reed had alluded to, taxing on our healthcare resources, because the pure sheer number has definitely increased from where we were at in the beginning of the pandemic. We also monitor certain demographics to help us target our efforts. So race and ethnicity, as well as age groups, are monitored and have been monitored from the start of the pandemic. So we've seen some shifting that has occurred. In the beginning of the pandemic, we were primarily seeing the older age populations that were impacted by COVID. Then that age group dipped down to mid to older adults. Certainly when the colleges came back to campus, the college students came back to campus, we were inundated with cases from the college age population. And now over the last few weeks, since our case counts have gone up, we're at an average age of about 34, 35 years, which is important from the school perspective, because when you look at the age of parents of students who attend your district, that's an indicator that you want to keep an eye on of where the primary ages are that are impacted by COVID. We're also looking closely at our ethnicity data in the city of Bethlehem. So over the last few weeks, we've had our cases range from 40 to 50% are reported of Hispanic ethnicity. So again, that's an important metric that we keep an eye on as well. As far as decision-making, and I'm sure most of you saw the video that was released last week, I'll reiterate some of the facts in that video, but we do look at several different metrics when we're looking at decision-making, as far as if we need to switch our operational model from hybrid to closing a school. So of course, looking at what's occurring in the community is important. And as I stated, we're looking at the incidence rates, we're looking at the positivity rates, and we're also looking at our hospitalizations, but we're also looking at what's occurring inside the school setting. So looking at our cases and looking at our cases based on the size of the school and the student population. So initially, when the Department of Health released their recommendations at the beginning of the school year, they had basically a one-size-fits-all plan. So they didn't take into account the size of the school building when they laid out how many or the certain number of cases that would indicate or recommend a school closure. But that is something that we've been taking into account since the beginning of the school year, because a Liberty is very different than a William Penn or a Thomas Jefferson. So certainly taking the number of cases by the student population is something that we look at very closely. The school district's also monitoring the absenteeism data by building. So that's something that goes into our decision making. Any documentation of school spread, so any positive case, an investigation is conducted, as well as contact tracing. So we've been fortunate thus far where there really have been minimal contacts anytime that there's a case, really due to just the hybrid layout and the fact that we've been able to significantly reduce the number of students in the building at one point in time. So individuals can safely socially distance and they're masked. So we haven't had a huge impact with contacts occurring in the school setting. But when there are contacts that are identified, we do follow up with those contacts to make sure and monitor to make sure if they test positive or if they remain negative. So documentation of school spread is something that we look closely at as well. And then looking at the number of staff and students quarantined. So all those metrics are looked at closely. Certainly Liberty was a school that had a certain number of cases that we were looking at very carefully over the last few weeks. We made the decision not to close because we looked at all of those factors. There was no evidence of school spread or that the cases were interconnected. We looked at days of the week that the students went to school to see if it was lopsided in any way, and it wasn't. It was a pretty even split between the students that tested positive that attended school on Tuesday and Thursdays as compared to the Wednesday and Friday. And again, our contact tracing efforts did not yield any association between the cases. So based on looking at all the factors, we decided to continue with the hybrid plan in the school setting. And additionally, a decent number of students had already been quarantined because they had already been named as a contact from an outside school association. So many of the students that we had interviewed had already been out of school by the time that they were infectious and became positive. So now we switched to today, where the new mitigation orders were released, and part of that order certainly impacts schools. up until this point in time, it's really been joint decision-making between the school district, the health department, St. Luke's, Lehigh Valley has weighed in. So we're looking at a variety of metrics. And while I think it's great if you have a nice algorithm to be able to follow, it makes things easy. It's not always the best tool to use because there are such a variety of factors. So the Department of Health has kind of moved slightly away, or they have moved away from letting those recommendations solely up to the local health departments and local school districts. So what happened today, I had a call prior to the press release with the Secretary of Health. So all the health departments were on a call where the mitigation strategies were announced, and there was a lot of questions around the school setting based on the new instructional models that were released. So the model that was released, one of the good points is it now does break up the recommendations by school size. So there's 3 different tiers based on the school size. So it's not the one-size-fits-all approach anymore. But the one thing that they changed is the recommendation regarding substantial spread. So the recommendation earlier had been to close a school if your county is in substantial spread. Again, we looked at all the factors in determining what we were going to do with the Bethlehem Area School District and felt, even though there was substantial spread that was occurring in the county, that in the school setting, we didn't have school spread. So the Department of Health has stated at this point, if your county isn't a substantial spread, that the school district needs to sign an attestation stating that they're going to abide by all of the recommendations that the Secretary of Health is putting forward. So some of those recommendations are things that we've been implementing and have put in place since the beginning of the school year: the cleaning and disinfecting, the contact tracing that needs to occur, the masking, socially distancing, etc. But the other recommendation that needs to be implemented is the clear-cut thresholds that they have established for when to close a school down and for specific timeframes. So again, prior they had the recommendations. They were just that, they were recommendations. We looked at those recommendations along with a variety of factors. Now basically these are the recommendations you must follow. So it doesn't necessarily matter if school, 100% of the students that tested positive were all out for 2 weeks prior to testing positive. It doesn't matter that there's no evidence of school spread. You need to go based on these numbers. And basically, if you're in a substantial spread county, you need to attest that you're going to follow that. If you don't, the Secretary of Health has stated that they will shut school districts down. So again, this is all new. We're still trying to sift through all the facts. I know that there's backup documentation that the state is working on. So I only know what was presented on the call today and the documentation that I have reviewed thus far. Certainly, again, while an algorithm is nice and it's very easy for decision making, I don't feel that it's in the best interest of the school districts. Just from everything that we've seen as far as data and just the research that's been out there, nationally and internationally, schools are documented time and time again that they are a safe place. And I'm not confident that if we do shut schools down, that we're going to impact and decrease the spread that's occurring in our communities. We're clearly seeing from our contact tracing efforts that the positive cases that our students or staff in schools, they're getting it because they have family members who tested positive. They're getting it from events and extracurricular activities that they're involved with outside of the school setting. So again, we're just trying to sort through all this information. This certainly came as, news that we weren't anticipating today, but we'll certainly continue to work with the school district. Myself, as well as other health directors, strongly advocated to the Secretary of Health to back off of those hard cut numbers because there are so many other factors that go into the decision making. So at this point in time, I'll pause and I'd be happy to answer any questions that anyone may have.
Questions? There's one question in the Q&A asking, clarifying about when the Secretary of Health would shut down BASD based on the county rates.
So it's based on certain thresholds, and there is a new document that was released today called Recommendations for Pre-K to 12 Schools Following Identification of COVID Cases. And it's basically a 3-tiered matrix. starting with what they recommend for small schools. So that would be buildings with less than 500 students. Then the next tier is for school buildings with 500 to 900 students. And then the large tier is over if you have over 900 students in your school building. So based on the spread in your community, it dictates how many cases you have per building and then how long you would need to shut down for.
We can put that up on the screen. So, but if the district does not do the attestation and does not close, then the Secretary of Health would close the district, order the district closed if you're in substantial spread, which we are.
Correct.
So there really the options are go online. That's one option on this form that Mr. Fascinetto and I have now. The other is stay open, but close when you have the right number, the number of cases that they say, or don't do the form and the secretary will close the district completely. So yeah, it's pushing harder on districts, but Marie, if you could continue to scroll through just to give you an example of, see now, if you can go down a little farther on that. This is just the example of the small elementary school, and keep going a little bit more because we're in the substantial. So here is the recommendations. I'm looking in the middle column. I think it was if there were 2 to 4 cases in a school, should consider altering schedule to significantly do, well, that's what we already do. Close school for 3 to 7 days. That's the issue that we're talking about here, is if we may not, based on our inside knowledge and understanding from the health department and our contact tracing, think that that's necessary. But this is saying now we have to abide by that recommendation. But then it has the asterisk at the bottom there. It says if case investigations, contact tracing, and cleaning and disinfecting can be accompanied in a faster time frame, the closure can be shorter. So for example, and Director Wendrick mentioned this, a lot of these kids have already been out of school for a while. Because they've been quarantining because of a family case. So the student's been gone for 6 days. Some of them have gone for 15, 18, they've already been out. The cleaning is kind of past the point for that individual student. And we've already done our contact tracing. And so then I ask, why are we closing? Why would we be required to close if it's not spread? So this is what we're going to have to work our way through. Marie, if you could just scroll back the other way, please. Just go back up to the top. And this document, sorry, I'm trying to control it on my screen and on my mouse pad. It's not working, but you'll see there, just the blue. That's a good example right there. So this is a school of less than 500, which would be every one of our elementary schools in hybrid. We kind of have assumed, though it wasn't clear, that the state is talking about number of hybrid kids in the school, not the whole population, which is how we've been looking at it. And so that'd be all of our elementary schools, and number of cases within a 14-day period, 2 to 4 students or staff in the same building over 2 weeks. I guess we'd go to the upper end, 4. But that's, we have a number of elementary schools right now that have 0 cases, and we have a number that have 2 to 3 cases. I don't think anyone has 4. But then we would be in a position to say, oh, we have to close, even if that's not where we would have gone, or for the middle schools or for the high schools, the numbers just get larger. So that's the position that, and the real challenge here is, I'll just stick with the elementary school. Say an elementary school has four larger of our elementary gets 4 cases. We say, well, we got to close for a certain number of days. It's not clear exactly how many because we can get it done faster, and now we're open. Whoops, we got another new case. Now we have to close again. And that kind of on and off, open, close, parents can't deal with that. I mean, you have to have childcare, have childcare issues. And so I don't know. My recommendation is that Mike and I, Mr. Fascinetto and I, will sign the attestation that we're going to continue doing what we're doing with the hybrid. But following these recommendations, if it gets to the point where we're like open, we're closed, we're open, we're closed for individual schools, then we're going to be forced into closing the whole district down, I think, because that's just not, we just can't put that on parents on short notice. It'd be like a sudden snow day repeatedly, possibly.
Just so a clarifying question, that this is specific to schools. So long as you sort of agree to follow these guidelines, the closure would be a specific school.
Correct.
So in the same way we're tracking individual cases and the spreadsheets running on that, we could have 22 buildings on 22 different schedules. You know, if
yes,
would be point. Another sort of logistical.
Yes. Okay. Thanks. I hadn't even gotten that far
Sorry.
in my nightmare scenario.
Happy Thanksgiving.
Right. We could have one school closed for the next 3 days, another for 7, another up, and now a new one comes online. Yeah. Okay.
And just to be clear, this is triggered by the fact that Northampton and Lehigh counties are in the substantial spread. Just because they're in substantial spread does not mean that these would go into effect and we would shut schools down. The schools would have to have cases.
Correct. Yep.
That would then
be
triggered. So if they had 2 to 4 cases, but we were in moderate spread, none of this would go into effect.
Well, Marie, if you could scroll down, just keep, if you go there, Mike, there's the low and there's the moderate.
Yeah.
So they actually still have the closed schools under the moderate as well.
Okay. Well, that at least makes more sense. I didn't get a chance to see this earlier because I was saying if you only have to close if you have those cases, what does it matter what the spread is? The cases are in the building either way. All right. Well, interesting.
So, yeah.
The other quick observation while Kristen's still here and you can comment, you don't have to comment, but just in case I'm saying something grossly negligent, when I look at our dashboard, which I've been known to do from time to time, when I look at our dashboard, I see about 12 cases or so between BASD Cyber and eClassroom, and then I see about 35 or 40 cases of in-person hybrid students, which would fit the model and to say that there is not spread in the buildings because 25% of our kids are in eClassroom, 25% of our current cases are eClassroom students. And not that that makes anybody sleep better at night, but it just kind of pops out to me that that's fitting the narrative that we're not having spread within the buildings, or we would have far more cases of kids who are in hybrid than we do eClassroom.
Yeah, absolutely. And that is a metric that we're looking at as well. So you're spot on with that. And again, reiterates the point where schools right now are one of the safest places to be. Because the rules are enforced there, the number of students that are in the classroom are minimized. So I'm willing to do whatever I can, and I know there's several other health directors that feel the same way, to just advocate where we have more control so we can look at the full picture instead of just these, you're in substantial spread, so therefore you meet this number, you need to shut down. There's so many other variables to look at.
And
that's actually... Sorry.
Dr. Reed, go ahead.
That's actually been our recommendation from a healthcare perspective too, because we have seen very little infection rates related to academic school settings. We are starting to see more related to athletics, but nothing, almost nothing related to school itself. And so our recommendations are always very similar to what Kristen just said, to ensure that we're tracking on a school level and be ready to pivot, but otherwise continue with that hybrid education.
Thank you. And the other enormously important point is our kids need school. All of our kids need to be in school more than 2 days a week, but 2 is the best we can do right now. But for those kids with the greatest need and the most at-risk kids, they need to be in school. And so an arbitrary number to say, if you hit that school has to close, really is missing the boat as far as the other part of what we're responsible for, which is, taking care of children and educating them. So this is going to be something we have to navigate over the next week or so, and maybe a couple of days to see how any clarifications that come out from the state on this. See, we're fortunate. And board members, you've heard me say this before, because we have such a close partnership with St. Luke's, because we have our own health bureau, we I feel are much more in-depth and sophisticated in how we're looking at data, how we're conducting contact tracing. And I want to have Dr. Brannon talk to that in a second, than a lot of other places that I'm familiar with, just because we have these expert resources.
Just wondering, is there a category above substantial spread? Like I think Kristen said, we're at 276.9 per 100,000 in Northampton, 294.5 in Lehigh. Is there anything that once you hit 300 or 325, is there a maximum spread, or is substantial spread the top of the line in that regard?
At this point, yes, which is defined as when you're over 100 cases per 100,000. So substantial is as high as it goes right now at the 100 per 100,000.
Okay, thank you.
If I could then ask Dr. Kim Zeitek-Brannon, our Supervisor of Health Services. Kim, so now picture we went from kind of the St. Luke's 50,000, 30,000 foot down to the city view. Now we're down to in the war room, if you will, making the phone calls, talking to families, doing the tracking. So Kim, if you could just talk to the board and the public a little bit about, what that looks like. What happens when a case comes in?
Certainly. First, I wanted to inform everybody that the Bethlehem Health Bureau, through a grant, has hired and she has started a COVID school liaison. So she works with me full time, and she also helps me with the contact tracing. So I just wanted you to be aware that the Health Bureau has done that for us through a grant. So once we receive communication that a student is positive, and that can be from a parent, a guardian, principal, nurse, teacher, we confirm with the Health Bureau. They have a laboratory database where negative and positive COVID tests are put in, they're dumped in, and so they will confirm for us if that student is definitely positive. Once we know that, we start with our interview. We interview the parent, guardian, and also the student, especially if they're in secondary, to ask them questions about if they mask, if they're socially distant, how they are in the cafeteria, do they talk to the students next to them? We also ask if they are symptomatic. We need to know if they started with symptoms, when they started with symptoms, and then we ask when they were tested and the date of the test result. We also ask parents if they know where the spread began. Sometimes it's from a family reunion, a family dinner. I had several today from coworkers that were positive, just birthday parties. And then also, of course, Labor Day, we had a few. So we talk about close contacts and exposure in the family. We also talk about siblings. We also ask about siblings in the Bethlehem Area School District, where they attend, what schools they attend, because they will need to be quarantined. And then we also ask, and this has increased, we ask if they're Tuesday, Thursday, or Wednesday, Friday, or they e-classroom. Also, vote tech. Our high schools go to vote tech, AM or PM, if they're in the charter academy, and also if their students, elementary, some middle schools attend a daycare. Then next, we have to find out when they last were physically in the building, if they attended hybrid or vote tech. So last days they were in vote tech or hybrid. Also, we ask if there were any in-person meetings. So that last day, were they with a school counselor, a school psychologist, instructional assistant, speech therapist, reading specialist, IU staff, and also we have our medical and dental van staff that are coming into our buildings. So we want to know if that student has exposed any of those staff as well. Transportation, we deal with our transportation department. Did parents drop them off and pick them up? Are they a walker, or did they ride the bus? So we look at all the seating charts for the bus. We look at the video. Were those students on the bus for more than 15 minutes for the ride or less than 15 minutes? We also look at, and this was new to me this week, the vote tech. Students can be dropped off and picked up by parents, but they may ride the bus from Liberty to vote tech and back. So we need to look at that as well. So we work very closely with Jenny Casebolt in transportation. Also, if students are student athletes, are they in extracurricular activities such as band, chorus, when they were last at that practice or last at that game. So we need to look at the other athletes. Cafeteria, breakfast and lunch. Some of our high school and the elementary schools eat breakfast when they come in. So where are they eating breakfast? In the classroom? Who are they sitting next to? And then also lunch, because they have their masks off. Are they 6 feet? Are they talking to the other individual on the right or left? So we need to ask all of those questions. The next step after that is I inform after I receive all of that information from parents, guardians, and student. I let Dr. Roy and his secretary know, so they have the information, the building nurse and the principal, and then Claire Hogan and Vivian Robledo, who are my supervisors. We then talk to the principals because they need to help us identify close contacts. And again, we go through the same thing that we ask parents. Are they being a role model in class? Are they wearing their mask? Are they 6 feet? What about the cafeteria? What about other meetings that they might have had with school counselor, school psych? So the principal needs to go to the classroom teacher and ask all of those questions, look at the seating chart, look at the cafeteria if there's videos, and see if that student was talking to the other student on the right or left. So this can take half a day or more just so that we get who are close contacts of this individual. The principal then does call me, and I then call the close contacts, inform them they were exposed to an individual in the building and the day. And then we talk about the quarantine and if they have any questions and when they can return to school. And the most important thing that we tell parents is that they are not missing school. They can still go online. So this is not them missing school at all. They can still go online. They're not missing their academics. With all of that information, as soon as the test is confirmed by the Health Bureau, we do not put out a letter or parent link until the Health Bureau has confirmed that positive test. The principal then will send a letter out to staff and parent and guardian, and we have a parent link, and then it is added to the database. We will add that, and then we also have the nurses. The nurses daily add students who are sent home from the Health Bureau that are symptomatic or kept home. And then I have a nurse and our COVID school liaison who cover half of our school buildings, who call those families on a daily basis to ask if they were tested. Is anybody in the family positive? We do build relationships with the families and they do call us back, but we need to maintain that communication so we know what is happening in that family, because we need to know if they have a positive test in that family. So after that, we follow up the close contacts until they can come back to school. I personally will call all of the positives on a Monday night to let all of them know who can return the next week. And honestly, I was telling Dr. Roy the other day, when I call them, the parents are so excited because the students are so happy to be returning to hybrid.
All right, thank you. Any questions for Kim? I wanted to take some time, and thanks for the board's indulgence on that, because I wanted to dig down in to give you we're thorough. We're not messing around. And so that's why there's some frustration with the Department of Health and PDE just picking an arbitrary number and saying, hey, if you have X number of cases, you can't let these kids come to school. And so Kim has done a fantastic job, and her team, all hours of the day and night and weekends. Kristen with the Health Bureau has been a tremendous partner. Raj Reed at St. Luke's and all of our St. Luke's folks. Dr. Anita Shaw is our medical director, pediatrician, who also joins all of our meetings. And I appreciate both Raj Reed's and Kristen Wenrick's availability. I know I'm annoying at this point. They'll be like, oh God, he read something else. And then I'm sending them, what about looking at by zip code? What about by census tract? And so I don't really apologize for that, but I do appreciate their patience with me on that. So thank you.